So whenever I think of occupational therapy on the pelvic floor, I'm thinking of quality of life. I'm thinking of full function. I'm thinking of sexual health. I'm thinking of all those things because they're very important. And that's kind of the mindset that I had when I went into medical school. Medical school does a number on you. Medical school makes sure that you absolutely are evidence-based and you're going to be randomized control, all these things. So there was a time that I kind of lost my way in the seeing my patient as a whole person. And it wasn't until about 10 years ago that I realized, man, all those things that I learned back in my occupational therapy world is very part of who I am today and is very part of how I need to establish myself with my patients. So what I did, which I think is equivalent to occupational therapy, is that I got a fellowship in integrative medicine. So integrative medicine basically says that each patient's an individual, that we have to meet them where they're at, that the Western way of medicine is good for some things, but it's not everything. And that the Eastern ways of medicine, it has a lot of things that we absolutely shun, but that work well. But there's some things in there too that can hurt a patient. So why not use the things from all the access that you have to approach a patient? And that's kind of my mindset between integrative medicine, occupational therapy, and then my medical mentality is kind of how I approach my patients.